start recording. Okay, today what we're going to talk about is the muscular system. I asked for ideas, I think, the last time, so I've got an idea for the next one, but I need to come up, I've got 2 in October, I need to come up with another one. So if you have any suggestions, put them in the chat box. I'm trying to hide it. Let's see. Commas. Oh, Lisa, I don't want to do commas, but I will write that down. I hate commas as much as you all do. Okay. Hi, Judy. Judy says hi to everybody. Oh, Roberta says how to catch the small words when you're checking. Okay, we'll go ahead and get started, and as people come in, they can just catch up. And you know, I like it to be interactive, so if you got questions or comments, feel free to ask. The first slide says, what does amputato mean? And these are terms or word parts relating to the, Lisa says to cut off, relating to the muscular system. Right, to cut through or cut off. Judy says amputate/remove. That's exactly right. So amputation is just the severing of a limb or part of a limb, the breast or other projecting part. An amputee is a person with one or more limbs either partially or entirely amputated. See if I missed any chats. No, that was Judy. The reasons for amputation, and I threw this in here because I thought it was kind of interesting. The most common is poor circulation because of damage or narrowing of the arteries called peripheral arterial disease. And, you know, a lot of diabetics, if they don't take care of themselves and take their medicine, you see a lot of diabetics having toes or even their foot or leg having to be amputated. A severe injury from a car or a serious burn, a cancerous tumor in the bone or muscle of the limb, a serious infection that doesn't get better with antibiotics or other treatment, thickening of nerve tissue called a neuroma, and frostbite. Okay, what does brachio mean? Oh, Patricia says branch. Natalie says, may not be pronouncing your name right. It looks like Natalie says branching out. Okay, let's see what it means. Come on in, Sabrina. Lisa says upper arm. Oh, thank you, Natalie. It's pronounced like I've started out with. I hate to mispronounce a name. Okay, the resource I used had arm, but branching out would be the same thing because the arm goes out. And some words that start with that brachio are brachia, which is the plural of brachium or arm. Brachial is relating to the arm. The ending AL means related to or pertaining to. But brachialgia is pain in the arm. Any word with algia means pain. Brachiocephalic means relating to both arm and the head. Cephalic is head. Brachiocrural is relating to the arm and the thigh, and cruel is the thigh. Okay, just double checking I hadn't missed a chat. Usually I see the words pop up. Brachiocubital is related to both the arm and elbow or to the arm and forearm. A brachiogram is tracing of the brachial artery pulse. Okay, do you all know where the brachial artery is located? Come on in, Coralie. Some of you might not be to the point of the muscular system, which I didn't get this info out of the course. I got it from an old textbook. It's located, you can see right here, it looks like in the forearm, in the crease of your forearm. Okay, anybody know what clado means? It's a good refresher to go over the word parts because sometimes, and I'm guilty of it, I type the words and I forget sometimes how to break them down to what they mean. To clot or clump together, Patricia asked with the question mark. Anybody else want to take a stab at it? Clavicle. It actually means the clavicle. Natalie just typed clavicle, like in the word sternocleidomastoid. What is another? Oh, Kelly says to slope or bend and then clavicle. What's another term for the clavicle? Collarbone's what Kelly says. Well, I didn't put the answer. It is collarbone, though. Natalie says shoulder. That would be acceptable too. Okay, cladocostal is relating to the clavicle and a rib. Cladocranial is relating to the clavicle and the cranium. Cladotomy is cutting the clavicle of a dead fetus to effect a vaginal delivery. I had never heard of some of these words. What does dactylo mean? Lisa says finger. Patricia says digit. Okay. Roberta says she goes with digit. A finger or a toe, which Judy says digit. That's what the finger or toe is a digit. Or they're also called phalanges. Kelly says yes. Okay, I found a lot of words with this. Dactyalgia is pain in the fingers. Dactylitis is inflammation of one or more fingers. Dactylocampsus is permanent flexion of the fingers. Dactylocampsodynia is painful contraction of one or more fingers. Dactylology is the use of the finger alphabet in communicating. Dactylospasm is spasmodic contraction of the fingers or toes. Polydactyl, that's a good word with it, Lisa. What does fascio mean? Roberta says tendon. Kelly says muscle membrane. Patricia says fascia. Lisa says bundle. Sorry, my chair's still squeaking. Every time I think about it, my husband's not here to do it. Okay, it says a band is what the information I got. But let's look at some of the words. Fascia is a thin layer of connective tissue covering, supporting, or connecting the muscles or inner organs of the body. A fascicle is a band or bundle of fibers, somebody said bundle, usually of muscle or nerve fibers. A nerve fiber tract. Fasciectomy is excision of strips of fascia. Fasciitis is inflammation in fascia. Fasciola is a small band or group of fibers, and fasciotomy is incision through a fascia. And here's a picture. You've heard of, I should have really put fasciitis because people have plantar fasciitis, and it shows the heel bone and where it's inflamed and then the plantar fascia. Thankfully, oh, Tina says she's had that, very painful. I was just going to say I've never had that, but I have heard that it's painful. Is that where they tell you to take a bottle of ice water and roll it on it, or get a ball and roll your foot on it? Okay, Tina says yes. Okay, I've heard people doing that to try to help it. Go to work at Home Depot. Let's see. Judy says go to work at Home Depot and you'll have it very soon. You must be standing on your feet. Jamie says what causes it? Well, I'm not really sure. Well, Judy's answered it. Cement floors and steel-toed shoes. Tina says muscle shrinking or overuse. Roberta says inadequate arch support. Okay, this picture is a fascicle, and right here it's showing the connective tissues, the blood vessels. This is the myelin sheath, the axon, and these together make up the fascicle. Or it might be fascicle. I can't remember which way is correct. A doctor may say it the incorrect way anyway. What does fibro mean? Natalie says fiber. Fiber or fibrous. I missed one. Fibrous tissues. Okay. Well, I must have been asleep when I did this. It's fibrous or fibrous tissues. That's what Corley's saying, fibrous tissues. I put the words, but not what it meant. Fibroadipose is relating to or containing both fibrous and fatty structures. Fibrocellular is both fibrous and cellular. Fibrochondroma is a benign neoplasm of cartilaginous tissue, and fibrodysplasia is abnormal development of fibrous tissue. Wait a minute, I think I see somebody with their hand raised. You want to speak? I'm not sure. Is your name Beverly? It's missing a Y if it is. I thought maybe you had a question or your hand's raised. Okay, let's get back to the next one. Fibrogenesis is the production or development of fibers. Fibroma, a benign neoplasm derived from fibrous connective tissue. What does ISO mean? That's one we may not see much in medical terminology. Equal, Patricia says. Did I miss anybody else? Similar, Kelly says. Lisa says equal. Very good. Judy says the same. You all know your word parts. ISO, Corley says equal. You all have done well so far on these. Isocellular, composed of cells of equal size or of similar character. Isodynamic, of equal force or strength. Isoenergetic is exerting equal force, equally active. Isometric is equal dimensions. I know this ought to be an easy one. What does musculo mean? Ooh, y'all are saying them so quick I can't get everybody. Everybody's saying muscle or muscles. You all must be past, some of you must be past it is muscle, past the muscular system, because y'all are doing well. Okay, musculocutaneous is related to both muscle and skin. Musculomembranous is related to both muscular tissue and membrane. I know you've heard this word, musculoskeletal, relating to the muscles and the skeleton. And this skeletal, I say skeletal, but one of the other instructors, and I think she lives in Canada, says skeletal. I'd never heard it pronounced that way, but we pronounce things different. So they would probably call this musculoskeletal, which you know that looks like that too. Oh, Roberta says British. Okay. When she first said it when I come to work, I thought, what is she talking about? And then I finally figured it out. Musculo. Oh, Judy says not Canadian, British. Okay. Musculospiral is denoting the musculospiral nerve. Canadians are supposed to speak the Queen's. Lisa says English. Let me read that. What Lisa put. I did not know that Canadians are supposed to speak the Queen's. When I signed on to Skype this morning, Roberta says, as a Brit, I can tell you they don't. And Judy says, where is that written? I wanted to mess with the other instructors, so when I signed on to say good morning, I did. I took 2 years of French, although I don't remember much. But I put bonjour, mes amis, and that means hello, my friends. Lisa says ABCs say Z. Z, Lisa, yes. The first time I heard that, I didn't know what they were. A lot of the people I work with use that Z, and I'm like, what? Oh, Denise says she's French. Bonjour. Okay, I'm steering you all off topic. Musculo, Z is British too. Okay. Musculotendinous is related to both muscular and tendinous tissues. It's interesting, the different languages. What about myo? Does anybody know what myo means? Patricia says mucus. Lisa says muscle. We're getting different answers on this one. Okay, I got a bunch now. They're clicking too fast for me to read that say muscle. It is muscle. Very good. Hello, Mary. Okay, some of the words with myo. Myocardium is the middle layer of the heart. It consists of the cardiac muscle. Myoblastoma is a tumor of immature muscle cells. Myocardiography is suture of the myocardium. Myocarditis, whoops, my fluency was about to time out, is inflammation of the muscular walls of the heart. No, Lisa asked, let me open it back up. Lisa asked, is it just heart muscle in particular? And it's not. I just happened to pick some words that do refer to the heart. Myocele, protrusion of muscle substance through a tear in its sheath, so that could be somewhere else. The myoblastoma could be. Okay, I got a lot of people commenting. I got to get back here and read this. Patricia says MY, MYC, and MYX always confuse me unless they are in a word. Now, I get confused with the MY and the MYC. Roberta says rectal. Mary says Achilles. And we're talking about the mycele and myoblastoma. Roberta says she saw mycele associated with this. Mary says yes. Kelly says thank goodness for Google and Stedman's. That's for sure. Hi, Sheila. And here's the myocardium. It's not a real clear picture, but the aorta is up here. It's showing, and it's cut off, the endocardium, and this kind of pinkish color is the myocardium, which is the heart muscle. Okay, here's a lot more that's not pertaining to the heart. Myositis is inflammation of the abdominal muscles. Myocirrhosis is waxy degeneration of the muscles. Myocolpitis is inflammation of the muscular tissue of the vagina. Myodiastasis is separation of muscle. Myodemia is fatty degeneration of muscle. And myofunctional is relating to the function of muscles. So here's some different ones pertaining to different muscles. And I've got some more. Lisa says COLP being vagina. That's right. Myoid resembling muscle. myologist, and I thought this was funny, the definition they had. One learned, or you may should say learned, one learned in the knowledge of muscles. A myoma is a benign neoplasm of muscular tissue. Myometrium is the muscular wall of the uterus. Myorexis is tearing of the tissue. So we've got lots of different ones here. I thought I saw another chat, but that was Lisa's. Okay, and here's the, excuse me, the myometrium. This is the fuzzy picture too, but it's right here. And I think that's the endometrium right here that goes along the edge of it. My pictures, when I try to blow them up, get all fuzzy. Okay, I bet you know this. Endo is the lining. Oh, Kelly says nerve. What does neuro mean? Natalie says nerve. Corley. Yeah, I'm sure you've heard this. Everybody's saying nerve. Neuromuscular pertains to both the nerves and the muscles. Neuromyopathic. Oh, Murray says, and dealing with the brain. Neuromyopathic is pertaining to a disease condition involving both nerves and muscles. Okay, this is our unusual one, and the first time I heard one of these words, I had no idea what the doctor was saying, but what does rhabdo mean? I think the word I heard was rhabdomyolysis, and of course the H is silent, so you wouldn't think. Patricia says rod. I missed one. Rod shaped. Oh, I can't see if you're Beverly or what your name is. She's trying to get on the phone, but it won't let me. They say the access code is invalid. Beverly, can you hear what we're saying? Sheila says skeletal. Let me type in here and see if she can hear. Well, I can't get her name spelled right. My fingers are on the wrong keys. I don't have the access code. I don't know if that comes from student services or where that comes from. Okay, we got some more answers. Striped, and Judy said when your muscles break down. Judy says call IT at CanScribe. Let me see if she can. I sent you a message to call IT. That's something I don't know anything about, is the technical things. Okay, everybody did good. It's rod or rod shaped. Rhabdoid is rod shaped. Here's the word, rhabdomyolysis. An acute fulminating, which is running a rapid course, potentially fatal disease of skeletal muscle that entails destruction of muscle. I had no idea what the doctor was saying with this word. Rhabdomyoma is a benign neoplasm derived from striated muscle. Somebody said striped or striated, occurring in the heart in children. Here's the odd one, rhabdophobia, a morbid fear of a rod or a switch as an instrument of punishment. And rhabdosphincter is a sphincter made up of striated musculature. What about sarco? Lisa says she would be afraid of a switch too. Yeah, my mom had one of those. We call it a Easter bush. Patricia says flesh or skin, and she'd get a switch off of that and it would hurt. Now, if you do that, it would be child abuse, I'm sure. Kelly says flesh. Lisa, flesh. Okay, everybody's going to flesh. Corley and Judy. Right, that's exactly right. Sarcolemma is the plasma membrane of a muscle fiber. Sarcoma is connective tissue neoplasm. It's usually highly malignant. Sarcopenia, loss of skeletal mass normally seen in association with aging. Sarcopoietic is forming muscle, and sarcosis is an abnormal increase of flesh. You all are doing good on the word parts. And here's a picture of sarcopenia. This is probably a younger man, and then, well, woman, whatever, a person. And then as they age a little bit, it gets like this. And then when they're elderly, it's really slim. I'm trying to see if Kelly says, would that be degeneration? I guess it would, kinda. And let's see. Patricia says sarcopenia, is it only with age or after an injury as well? Patricia, that's a good question, and I shouldn't have said just with age because it could be after an injury. You're exactly right. Lisa says, would that be related to atrophy from lack of movement? It probably would, Lisa. I can see it in my dad. He's lost a lot of weight, and I can see a big difference in him. And um, you can almost see his ribs and everything. And I call that, um, well, muscle wasting, which that ties in with this too, because the muscles aren't like they used to be. And atrophy is a more or less wasting of the muscles. Murray says both. Judy says it's a natural part of aging. And Murray says in some cases it will. It's really, this is off the subject, but it's really hard to see your parents or whatever, grandparents if you have them still, to get in this condition. That's the hardest thing I've ever had to face, was my parents getting old. Judy says that's why exercising is so important. Kelly says yes, it is hard to watch. Mary says me too. Well, you got a good point. Patricia says be glad they're getting old. That's exactly right. Okay, let's see what's next. What about synovo? Synovo. What does synovo mean? Joint. Patricia says joint. I thought I saw another joint. Okay. Lisa says joint. Corley. Patricia says book says synovial membrane. I apologize for my phone. I keep it in here in case my parents need me. It's the definition. Kelly says membrane or fluid, and the one I found said relating to, containing, or consistent of synovial fluid. Synovectomy is excision of a portion or all of the synovial membrane of a joint. Synovitis is inflammation of a synovial membrane, especially that of a joint. I don't think I typed this one right. What does teno mean? Patricia says tendon, right off the get-go. Tina does, Kelly, Judy. Everybody's in agreement on that one. And it is tendon. Okay, here's some words I found about teno. Tenodesis is stabilizing a joint by anchoring the tendons that move that joint. Tenodynia is pain referred to a tendon. Tenolysis is release of a tendon from adhesions. Tenonectomy is resection of part of a tendon. And tenophyte is bony or cartilaginous growth in or on a tendon. And I found quite a few of these words. Tenontoplasty, I'm not sure how to pronounce that, reparative or plastic surgery of the tendons. Tenorrhaphy, suture of the divided ends of a tendon. Tenosynovectomy, excision of a tendon sheath. Tenosynovitis is inflammation of a tendon and its enveloping sheath. Let's see if Bev is still here. I'm not sure how to pronounce your name. I'm going to call you Bev. If you can't get in, it won't let you in. They'll post it on the forum. I'm not sure when, but the recording will be posted. Somebody's got me the pronunciation. Thank you, Mary. It's tenontoplasty. Tenontoplasty. Hi, Renee. Okay. I don't even know if she can hear me. Whoops, sorry, I keep going down on my taskbar. What does tono mean? Okay, Lisa says tone. Kelly says pre. Patricia says tone or tension. Right, you all were right on it. Mary says tone or tension. Okay, here's a few words. Tonometer. It's an instrument that determines the pressure or tension, especially an instrument for determining ocular tension. Tonometry, measurement of the tension of a part, for example, intravascular tension or blood pressure. Tonotrophic, denoting the shortening of the resting length of a muscle. I practice saying these words, and then when I get in here, I forget. What does torty mean? Okay. Twisted. Torticollis is a contraction or shortening of the muscles of the neck. I've heard that a whole lot in typing. Tortipelvis is a twisted pelvis. I've never heard that one before. And here is torticollis. Another word for that is Wryneck. It's like your head is tilted over to one side. Oh, Patricia says, that is where torturers came from. And I don't know. Oh, Judy says her neighbor has that. Is there any way to repair that, Judy, or do you know? I didn't research that, and I don't know if it's reparable. But that would be definitely bad. And I've ended, and I've still got 20 minutes. Oh, Judy doesn't know. Kelly knows the little girl with it. I think I saw Mary. Mary says it's a long process. Okay, we got to, unless you all want to leave, we need to tear up, or not tear up. We've got 20 minutes. Oh, Murray says it can be in most cases. And Murray's laughing at me. Oh, Lisa says it can become fixed too. Murray says, where's my grits? She misses her grits. Okay, anybody got any comments or questions? Oh, Murray says not in Canada. Murray, are you from the States originally? Judy says, listen to a program on auditory the other day, specifically transcribing and the most difficult accents to transcribe. Oh, I bet that was interesting. Chinese is the most difficult for me. And yes, Murray was from the States. Roberta says, can you speak to directional information that doctors give for surgeries involving muscles? Roberta, I'm not quite sure what you mean. If you're talking about if they say the names of the muscles, they do, because I've heard them. The one that comes to mind is the extensor hallucis longus in orthopedics. Speak. Oh, Roberta had misspelled speak. Middle, medial. Oh, directions. I'm sorry. That went right over my head. Yeah, they will use what's the terms? Proximal, which means close to something, or distal means away from something. What are the directions? Proximal and distal. Of course, medial is the middle. I've got a book somewhere that probably has it. They do use those in surgery when they're operating to tell you what's, let's see, like ventral is towards the stomach or belly, caudal is towards the tail or the bottom, cephalic is towards the head. So they do, and another one is above, they'll say superior, and below is inferior. Yes, they do use those terms in surgery. Judy. Judy says they actually said a southern U.S. accent was the worst. Okay. Lisa had a professor with the East Indian British accent. Couldn't understand him at all for the first semester. Murray says when the op reports or rehab reports. Oh, Roberta, you're right. She says sometimes they say medial, lateral, and interior/inferior. And there's combination words of those, and doctors don't always pronounce them, like if they say anteromedial or posterior-superior. And there's a section in the Book of Style, and I think it's under directions. Just a minute, let me look that up. Directional and positional terms. Yeah, in the orthopedic section 18.1.1, it says use a combining vowel to join directional and positional adjectives. And what they're given is mediolateral. Oh, yeah, Roberta, I figured out you meant infero. Mary says anti. Sheila says lateral, anterior, posterior. Murray says it's in my nursing books in the beginning. I've got a terminology book. In the second chapter, it talks about it. Oh, Judy says orad, superad, and ventrad. Roberta's asking, how can you differentiate between them? Well, and this goes against what CanScribe says type verbatim. If you hear anterior lateral, you should type anterior lateral. But I worked for a company that if we heard anterior lateral, we were supposed to type anterolateral and combine it. So go by your count specs first and type it just as you hear it. And sometimes it'll be hard, probably with the ESLs, to tell if there's a vowel between the two words, which to me it's really not. I shouldn't say it's not a big deal, it's important, but it's not going to change the care that the patient gets or explaining the op note. It's not going to affect that. Roberta says antero versus anterior when they speak fast. It just comes with practice, Roberta. Listening to the different accents and telling, and then sometime you can't tell, so you could leave a blank and put it in a guess what you thought you heard. Roberta says thank you. You're welcome. Judy says some are posture-based and some are region-based terms. That's right, Judy. Murray says Section 4, Specialty Standards and Nomenclature. Chapter 18, Orthopedics, Neurology, 18.1.1, Anatomic Terms. Roberta says sorry, typing without glasses. Renee says, can you spell that out on her for us? I will, Renee, let me get to the bottom of this. Judy says sometimes Latin and English terms are combined, which makes it more difficult to transcribe. There's your two examples, anteromedial and posterior-superior. You know, I don't think I should have that I in anteromedial. Okay, we still got about 12 minutes. If you want to stay, or if you got any more comments or questions, or you can go, whichever. I'm happy to stay. It's hard to time the PowerPoint presentations to where they work out exactly to an hour. I think one time I've had it perfectly work out to an hour. Any other comments or questions? Everybody's leaving. Well, you all have a good rest of the week. Kelly says, thank you so much for your presentation. Always appreciate it. I think I'm going to go and do some dictations. Bye, Kelly. You're welcome, Lisa. Talk to you later. Mary says she's had issues with your speed type. What's it doing, Mary? You're welcome, Tina. Ann says, thank you, Robin. Always good to have the review and info. Renee says, lots of work ahead of me. Have a gooder. You too, Judy. Have a great day if you hadn't already gone. Murray, you enter F/U to type follow-up. I think you can't put a punctuation symbol in there. That's probably what's messing it up. And you say it's not replacing. I'll tell you how I do the follow-ups. I type, and this is probably weird, I type FUP1 for follow-up when it's one word, and I type FUP2 when it's follow-up 2 words. Now that's just my little crazy system, but if you can think of something else without that slash. Oh, it did work for without? Well, it ought to work for follow-up, I would think. Oh, Lisa said it doesn't recognize forward slash. Murray says FUP1. Yep, I do FUP1 for one word follow-up and FUP2 for 2 words. Lisa says you could try a period. And V/S, the same problem. I don't think I have anything. Oh, vital signs. Maybe you could just do VS for vital signs. I don't have any with the slash. I'm sorry, I'm not no help on that. I'm not no help. I'm not any help. I'm from the country. My English goes back to the country sometime. I forget I'm supposed to be teaching. Oh, Mary lived in OKC. Oklahoma City, is that it? Renee says, I'm from the Maritimes. I get it. Oh, Murray says, that's why I understand you. And yes. Well, good. I have some students I talk to on the phone that have no idea what I'm saying. I finally slow down enough to where they can understand, but some students have problems. But you know, I don't have any problems with any of the students I've talked to. They think they sound different to me, but they really don't. Okay, Murray worked at Jim Thorpe for years and at OU Medical. Okay. You're really up on your medical stuff, Mary. Which all of everybody here done good today. Renee says Nova Scotia. Mary says it took me 8 years to get my license in Canada. Oh, Renee says Newfoundland or Newfoundland. Renee says New Brunswick. PEI. Lisa says Manitoba. Someone wanted to know where the Maritimes were. Where? Mary's in BC now. Renee says what, Manitoba? Lisa says Winnipeg. Okay, we only got about 5 minutes left. If you want to go, that's fine. We've about used up our hour. Murray says the Maritimes are the east coast of Canada. Okay, I didn't know that. I've heard of the Maritimes, but I didn't know what it was. Tina says very beautiful place. Mary says they used to be a part of New England. Renee says no. Mary says then the Revolution War. Oh, Mary says broke them up. Renee says British colony. Lisa says our history tells us that Florida was a part of Canada for a while. Mary says LOL. Okay, Mary's got a joke for us. Let's have it. We got about 3 minutes. What happens when you give a Cuban like me an inner tube in Bangkok? Lisa says anyone else excited the Muppets are coming back to TV? I don't know, Mary. You're going to have to give me the answer. Lisa, I guess my son watched the Muppets, but um, I'm not excited about it. Oh, Murray says I find Miami in an hour. Oh, Lordy. That was good. Okay, I guess we'll wrap it up. Y'all did good today. Murray says, and clean too. Stay tuned for my one in October about the online studying and note taking. You're welcome, Mary. You all have a good week. Type your little fingers off.